Hello, I am Operator Dr. Murat Kagan. Today we will answer the questions you sent in with Irem from Bilge Heart Travel. We will talk about the process before and after the surgery and the weight loss journey. Now, let's move on to our questions.
I decided to have this surgery. How many days do I need to stay in Turkey?
For us, 3 nights, 4 days, or 2 nights, 3 days are suitable. A patient who comes Sunday will have the surgery on Monday when the preparations are complete. They can return to their country on Wednesday or Thursday.
Okay, so what kind of preparations are we making for the surgery?
Of course, the information comes to you first. We are talking, if needed, we talk with our patient. Checking the height and weight. Does he, she take meds? They have other health issues? Sometimes before coming, we recommend a diet to our patients if necessary for conditions like fatty liver and what we call liver diet. Some meds need to be stopped before the surgery and other meds need to be started. We are discussing this with our patient.
But how long do I need to wait for pregnancy after the surgery?
We do not recommend pregnancy within a year after the surgery.
Okay. I got pregnant a year after the surgery. I have a risk of gaining weight.
Weight will be gained due to a normal pregnancy. There will be swelling in the body. After the birth process is completed, we will return to our old stomach shape where we get hungry less and feel full quickly. This is expectation.
Okay, I had a lot of skin sagging after the surgery and I want plastic surgery. How long do I need to wait for this?
We recommend 1 year because, as I mentioned, the ideal weight is usually reached in the first year or 1.5 years, so the weight needs to remain stable at a certain level. If plastic surgery is performed earlier, the weight loss process continues, and this time, the patient needs to have a revision regarding plastic surgeries. That's why we recommend 1 year.
Yes, I want to have surgery, I want to lose weight, but I don't want any scars on the visible parts of my stomach. Do we have an option for this?
Yes. SIS refers to single incision laparoscopic surgery. It's a general term for surgeries performed through a single incision. We can also use this method as scarless silvogastrocele, which is also known as a non-invasive sleeve gastrectomy. So, 200 centimeters from inside the belly, we can perform all the standard stages of the surgery in the same way by making a single incision. This allows for the incision to remain inside the belly, meaning that there will hardly be any visible scars left. We see that these patients experience less pain, walk more quickly, and return to work faster. We recommend scarless gastric sleeve surgery, non-invasive gastrectomy, for these patients.
Thank you. So, how soon can I return to work after the surgery?
For desk jobs, meaning jobs that don't require physical effort, we can think of around 3, 4. We can think of it as a day or a week. But for jobs that involve heavy lifting or require physical strength, we recommend about 1 month.
Why should I come to Turkey for weight loss surgeries? Why should I choose British Health Travel?
Here's the situation. This surgery is performed all over the world. If we talk about gastric sleeve or bypass surgeries, it doesn't matter. But in our country, 90,000 obesity surgeries were performed in the last year. This number is, for example, 9,000 for the UK. Actually, we have much more experience. And both in terms of tourism and health, we are at an advanced level in this regard. Only some news can come out abroad. So news about deaths or patients not being taken care of after the surgery, these death rates or complications are, of course, applicable to the whole world, and they are valid for all patients. They can be sure that as Turkey, I can speak generally, our complication rates or death rates are actually below the world average, but it can happen for some media-related reasons. But of course, no matter where in the world it is, the safety of the materials used when patients arrive, the surgeon's experience and the company they come from, Ajanta, should also pay attention to the dialogue with the person they are communicating with. We don't want to hear issues on these matters from anyone. We wouldn't want to hear it from our friend. But we perform our surgeries properly. We conduct our follow-ups properly. We are already in constant contact with our patients after they return to their country. If there is any issue, which thankfully we don't see, we always stay in touch, even if there is such an issue.
So, doctor, how many cases do you perform on average in a year?
In the last year, we performed 450 obesity surgeries. 10% of these patients are undergoing gastric bypasses and revisions. So far, none of our patients have lost their lives. We sent them off beautifully. But of course, we pay great attention because we are aware of the specific risks of this surgery. We take care of our patients both during and after the surgery.
I had a gastric sleeve surgery. I reached my ideal weight. But I started gaining weight again. My body mass index has started to rise. What criteria do I need to meet for a revision?
Revisions are based on patient needs. There isn't a specific criterion, meaning there isn't a required BMI that needs to be met. Here, based on the patient's complaint and request, you had a gastric sleeve surgery and gained no weight. You remain stable, but you have reflux and we need to examine that. You stayed on your stable path, but you have serious reflux and we need to examine that. Even if your body mass index is 25, 26, we might still need to convert to a bypass. A revision surgery might be necessary. To correct reflux, our patient gained weight. We suggest a body mass index of 30 for surgery. Are we doing a gastric sleeve? Decide via endoscopy and patient talks. We're going to convert this to a bypass. We can decide this through an endoscopy and talking to our patient.